Good day everyone. Today guys, I just wanted to create a video in support of those 3 brave emergency room nurses who are working at Ascension St. Joseph Joliet in Illinois, USA. 2 out of these 3 nurses who walked out are Filipino nurses. They went to the hospital so they can work, but they demanded that they will have a proper staffing before they start their work. Unfortunately, the manager wasn't complying and they ended up suspending those 3 brave nurses. So today we're gonna watch a video courtesy of Mr. John Larch, who wanted to spread this awareness to people all around the world that this is happening right now. So for tonight, let's watch this video and I'll be putting in some few questions and suggestions or comments about what we are going to watch. Okay, so let's start. Here from Ascension, who were walked out last night and were relieved of duty and probably suspended tonight. And just maybe introduce yourself shortly and tell us what happened last night and tonight.
Well, I'm Cisco, one of the nurses in the ED. Last night we came in with really short-handed, and we sit down, we talk to each other. Are we guys willing to go to work without help? And we decided not to go to work. I mean, not going in right away unless we have some help. Just correct my wordings there. So we sit down, and then we waited for them, and then when our manager came in and asked us, "Are you guys are willing to go to work?" And we answered, "Yes, we are willing to go to work. But make sure that we have enough help there, and we will go out there and we will work our best as long as we have enough help." And then she come out, go back again, and ask us again, and she even asked us, "I just want to know, yes or no." That's the question that she told us. Yes or no, are you guys wants to go to work? And we answered it, yes, we are willing to work. We repeated it again. We are willing to work unless we have enough help. Those are the things. And then,
so you made it conditional.
Yeah.
Okay. Here, as you can see, the manager asked this specific question. Do you want to work or no? Make sure that you answer this properly, because legally you'll be liable whatever you said. That's why this guy was like smart enough to answer this question. He answered yes, but with a condition. Because if you just say no, then you might be legally have some problems later on. That's why he did answer the way that he did. So kudos for Kuya for knowing what to say.
For almost 2 hours now, you guys need to go.
Okay, and you were scheduled for what, an 8-hour shift, 10-hour shift?
Scheduled for 12-hour shift.
In the emergency room?
Yes.
Okay. And you were all 3 there, all 3 ER nurses.
And this is the only supposed to that schedule that night, the 3 of us. There's one that is not scheduled to work tonight, but she decided to pick up last night. So we have 4 nurses.
Okay.
She did not pick up.
52 patients.
So 4. Okay. So there's only 3 nurses who are gonna work tonight, and 3 of them are these brave people. And I think I'm 90% sure 2 of them are Philippines or Filipinos. So hi to both of you. But there's supposed to be a 4th one, but did not come in because he or she already picked up the previous day. So there's only 3 of them. Okay. 4 ER nurses were asked to staff 52 patients.
With vented patients that are ready to ship out.
So like he said, 4 nurses or 3 to 4 nurses is going to work for the 12-hour shift in the emergency room department. And some of the patients are actually vented. If someone has a vented or a patient who is vented, that really requires a lot of attention. Particularly those who are really new ones or new patients who've been intubated, then they have to be like most likely 1-on-1 or maybe 1 to 3 ratio, like 1 nurse versus 2 to 3 patients in order to manage that. But with them, there's only 3 or let's just say 4 out of 52 patients. If you divide that, that will be like 13 patients each or around that number. So that is definitely not safe. Normally for ER nurses here, the ratio will be like 1:4. Okay, so just imagine 1:4 versus 1:13. And like I said, if there's a vented patient or there is an acute case or like a really critical case, it would be like a 1-on-1 in the emergency room. Yep, that's how it is. So just imagine how you're gonna do that with 4 nurses. 4 nurses, okay? So just imagine 1 nurse went with a critical patient. Most likely they have 1 or 2 critical patients per 12-hour shift. That's most likely. The possibility of that will be like 90%. So just imagine these 3 patients will cover for the 51 patients remaining. 3, okay? Not including those emergency things that's happening in the emergency room. So if there's something emergency happening, like example, your family or your dad or your mom had a heart attack, or they need to do a code blue, definitely those 3 will respond to those emergency situations. So meaning those other patients, like 50 patients who were left unattended because there's only 3 remaining nurses working that floor. See? That's how bad it is. So definitely you have to fight for this and support their cause.
Name's Julie.
Okay.
I was there last night too. Yeah, like he said, we were ready to go to work. You know, I came in a few minutes early usually because I wanted to check the you know, how many patients we have. Because I'm in charge, I have to assign
typical chargers.
nurses.
They do this. Come early and do the
they did not give us any
work
extra staff.
that has to be done during the shift, but they come early.
By the
just
charge nurse station, I look at the schedule, nothing changed. It was just me, her, and another person. And there's one person that's supposed to stay till 11. So
just 11.
that's not enough.
Okay.
So we asked our manager. I called her immediately. I said, hey, we needed help. So she came. We requested for bypass. She said the situation at the moment does not qualify us to go into bypass. So she said, you know, she's here and she's willing to help us. Now I asked her how long you're going to stay. She said she don't know. So I wanted reassurance from her that somebody's going to be there till 7 o'clock in the morning. Joliet's craziness does not start till like 3 o'clock in the morning, 4 o'clock in the morning. You know, a lot of elderly get up to go to the bathroom and fall like 5 o'clock in the morning. That's our busiest time most of the time.
So your busiest hours are 3 a.m. to...
Yeah. We are, there's a lot of people usually when we come in, but they're already been processed, you know, seen. But new patients come in by ambulance most of the time are in the middle of our shift or towards the end of our shift. So it was, you know, we needed someone to be there with us till 7 o'clock in the morning. And I could not get any reassurance. I was scared. I was nervous to go in, but I was ready to go in, you know. And I just praying to God that I don't kill somebody or anybody die on my shift.
Yeah, you would have to live with that the rest of your life.
Yeah, or hurt myself. Then I won't be able to work.
And so your name...
Okay, like what the second nurse said, she is willing to work, and during the early time, she knew, she looked at the case, at the assignment for the patients or for the roster of the patients, and she saw 52 nurses for only like 3 nurses on the shift. So she knew that there was a problem. So she tried to communicate with the management and she was asking for bypass. I'm not sure what bypass means, but I guess something to do with getting help, like additional staff during for that shift. But her management or manager said it doesn't qualify. So I'm not sure what qualifies for emergency need during this time with 52 patients versus 3 nurses or 3 or 4 nurses. So I really don't know. If you know the answer about the bypass or what conditions they are, please comment down below. But I really think they needed help. I'm sure they needed help. If you listen, she said she was a charge nurse on the shift. So out of the 4 nurses, 1 is a charge nurse. So she's doing the charge nurse work. Usually they have to do some extra work because of the documents or the filing, and she's responsible for the entire team. Like she's entitled for that shift because she is doing the charge work. So like what she said, she's scared for her license. She's scared for her license, for her life, and for her bag, or something that might happen.
We regularly run with 5, maybe 6 nurses that we're supposed to have. Start with 13, and then by 11 we're supposed to drop to 11 nurses. And we regularly run with 5 or 6. And I think last night was just 4 nurses. It was not safe for the patients. It was horrible to even expect us to try to handle that, and it was just the struggle that we're into.
So from what I understand, it's supposed to be 13, but went down to 11. Then now lately they're just running from 5 to 6 nurses per shift. So just imagine 56 or 50 plus patients for 5 to 6 nurses, and they're already struggling. And that, my friend, is also not safe with that number. So definitely they need more nurses. So just imagine they're doing like 3 or 4 nurses per shift, then that is definitely not safe.
And what are you? I heard you talking a little bit earlier how many hours you typically work. I don't know. You can each maybe tell us just briefly how many hours you work, and maybe how many years you've been doing this too.
I've been in this department for 17 years.
17 years.
And I see it's going downhill. You know, there's no progress in there. You know, we used to be happy here every day. We work every day. And now I always pick up hours when they texted me and need some help. Okay, I will go out there and I will help you.
Not ER nurse. I'm a nurse here, but
And,
not ER.
How many hours a week are you working?
7 days.
7 days a week.
12-hour days, right?
12 hours a day.
Wow.
I just come in here when they ask me to come in. Okay, I will help you guys out. But last night is it's time. Enough is enough.
And ICU nurses also walked out. How many ICU?
So, as you heard, he's been there for 17 years. 17 long years working at the emergency room department. That is definitely long, and that is a sign of loyalty. Okay, you don't suspend anyone who's been working there for 17 years. Not alone, like what he said, he's been working like 7 days a week. 7 days a week for 12 hours. That's how dedicated he is for his department. That's how he was trying to help his management or hospital just to fill in some slots, because that's how bad their census was, or that's how bad their staffing was. So he was trying to fill in. Like he said, whenever they text him, whenever they call him, he will just go. Okay, so that's the kind of person he is. And because of last night's incident, because they didn't have enough staffing and they could not call anyone and they could not fill in some of the shoes that they need to during the shift, they come in suspend this guy. Bruh. So, come on, 17 years. So that's really poor management. Really, like really poor management.
And ICU nurses also walked out. How many ICU nurses walked out?
That was Monday night, and same situation. There was 5 of them that had asked for service.
They didn't clock in, I guess.
That's what we did. We did not.
Unless they got staff.
Okay, and then tonight you guys wanted to go to work. We had a small rally. You went in to go to work. Tell me just briefly what happened.
They stopped us there and
The entrance.
and told us that they need to talk to us. So we said, okay, we're fine. And we sit down there, and Pat was there because they will not let Johnny go in. And then whoever that person there, they told us right away that we're being suspended until further investigation. So I told her, this is what we got.
So there's only 5 nurses working in the ICU department. See? 5 nurses. Just imagine if they have a lot of patients. The normal ratio for IC nurses would be 1:2 because those 2 patients are really critical. Anything that happens can happen in a split of a second that can cost someone's life. So they have to have only 2 patients as much as they want to in order to keep those patients safe. But I'm guessing they were giving more ratios. So I'm not sure what's the ICU bed capacity there, but they definitely need more staff.
Who is taking care of, you guys are already short-staffed, do they actually have ER nurses in there right now taking care of the ER, or is it administrative people who haven't changed or done anything? If somebody needs to get an IV, who's doing it? If there's an emergency situation where surgery has to be done right away, what's happening?
I don't know right now who's working there. The only, as far as I know, there's 2 nurses that will be there. 2 ER nurses goes out there, scheduled tonight. We don't know who's in there right now. Who will help them out? We don't know.
But you've been raising, you guys have been raising these issues for a while, and their response is to suspend you. How does that make you feel?
Okay, they don't know, no one knows, because the hospital is preventing anyone to go in. Even the union representative, they didn't want them to go in and talk to the management. Okay, so that's how bad they are. And I think something about the mayor was trying to get in, also try to talk to them, but the management doesn't want them to go in as well. The mayor of that city, okay? So they were really trying to block this. So no one knows what's happening. I'm not sure if management can handle those 52 patients. God forbid something might happen to those patients, but I'm sure they are also struggling to help those 52 patients with the kind of staffing that they have. So I don't know. I'm not sure really what's happening there.
You guys have been raising these issues for a while, and their response is to suspend you. How does that make you feel?
Yeah, we were waiting for more staff. We are actually waiting.
That's what I took care of as a CNA was 13 patients.
Struggling with them.
And we were putting on IV.
Because we were promised, hey, there's 4 more nurses coming. And we've been waiting for that, and, you know.
So they promised 4 nurses coming, but they haven't come. Like, this is really typical for management. They will always say, like, there are nurses coming. Don't worry, there are nurses coming. Help is on the way. But a few months after, no one is coming. So really, this is really typical. Even back in the Philippines or Singapore, they always say these things. So it is a global thing. So lesson learned here, don't believe the promises of your management, okay?
Add? Just short and sweet.
I just a little broken-hearted from, you know, they could have just told us that, hey, you just leave, but instead they have security escorted us like we're criminals. That kind of disrespect. You know, I mean, I'm not angry, you know. They have procedure they have to do too, but we're not violent people could have just walked out, you know. And
we just want to
so we are angry on your behalf, and
one
we
of,
thank you.
I won't be angry.
One of the other workers also walked out in solidarity. It sounds like tonight. So is she a ER nurse or?
Yes.
Okay.
It's actually my charge nurse when I started here.
Okay.
Yeah.
God bless you guys. We appreciate you.
Well, something tells me this isn't over. Thank you for taking a few minutes. Tell the world. We're going to be pushing this out over social media.
So there you go. That's the entire video. So it's really hard and saddening for these nurses because they have been there for working for quite some time and they just wanted to have a proper safe ratio, proper working environment or safe working environment. And this is meant for the nurses and not only for the nurses, but mainly for the patients. Okay? So they just wanted that. And for them to be escorted out with a security because they wanted to stand their ground and wanted to request for additional staff. They were escorted like criminals. That's really sad. Really, that's really poor from the management side. So they didn't do anything bad, really. They didn't. Okay, so they did not deserve that. And like the guy who was interviewing this, we will spread this. We will pass this along. We will share this information to everyone just to have this awareness and to fight this cause. This will definitely impact everyone. Especially those who are leaving this particular hospital in Illinois, in Joliet, you have to support these nurses. Why? Because they're just supporting to provide proper care to their patients. And those are you guys. You who are living around that Illinois area or anyone who are living near the hospital. They are in support of you. They just wanted to provide you better care. Just imagine, do you think they can provide a better care if there's only 3 or 4 nurses who are taking care of 52 patients? Just imagine your family, your loved ones, your mom, dad, daughter, son, your grandfather, your brother, sister. So whenever they come to the emergency room, either via walk-in or via an ambulance, and they only have 3 or 4 nurses assigned during that shift, do you think they can respond to you? It's not the same with the offices or anything like that. It's really different when it comes to dealing with lives. So you have to have proper, safe ratio. Nurse to patient ratio. You guys, the patients, deserve a proper quality care. And having short staffing is not a proper care. Okay? So, hope you guys support this cause, help share this video, help inform the people, help support whatever cause they're fighting for, or sign any signatures, or try to persuade those government officials or management in order to fix these kind of problems. Okay? So we want to make things better, so this is one of those things. Again, my name is Nurse Juan de la Cruz, your OFW nurse. Thank you for watching. God bless. Bye-bye. Stay safe.